We are nearing 2 full years of living in a global pandemic. As case counts fall, calls to loosen restrictions rise. Today, the director of the CDC said the agency plans to update mask guidance as early as next week. This comes as states across the country drop their own mandates, causing some confusion in some cases. Still, medical experts warn COVID is not gone and we may never see a so-called endemic. ABC's Stephanie Ramos joins us now with a look at where we stand in the fight against the virus that changed the world.
The global pandemic is in its second year. In the U.S., Americans still trying to keep themselves safe as the latest variant sweeps across the country, and now trying to follow the guidance for how to stay safe.
When it comes to masks coming off now, there are those who say it's about time and others who are still asking, are we taking a chance here before we know for sure that we're in the clear?
At this time, we say that it's the right decision to lift this mandate.
It's effective Monday, March 7th. The statewide school mask mandate will be lifted.
We are lifting Rhode Island's statewide mask or proof of vaccination protocol for indoor public settings.
Since February 7th, the governors of 11 states and the mayor of Washington, D.C. announced plans to lift some or all existing mask mandates. 7 of those states announcing school mask mandates would be lifted.
What you'd like to see is that mask mandates, whether they're implemented or lifted, is based essentially on data not only about cases, but specifically around hospitalizations.
One of those states is Massachusetts, where Republican Governor Charlie Baker said a high vaccination rate and dropping cases and hospitalizations meant the state was ready to lift its school mask mandate on February 28th.
And given the extremely low risk for young people, the widespread availability and the proven effectiveness of vaccines, and the distribution of accurate test protocols and tests, it's time to give our kids a sense of normalcy.
But Boston's Democratic Mayor, Michelle Wu, says the state's capital and largest city isn't ready to follow suit.
I will presume to know what should or could have gone into the governor's calculation. What I know is that the city of Boston is not ready to lift our mask mandate, and so ours will stay in place for the time being.
Meanwhile, these states lifting mask mandates aren't following the current guidance from the CDC.
At this time, we continue to recommend masking in areas of high and substantial transmission. That's much of the country right now in public indoor settings.
But the CDC today indicating that changes may be coming.
We are looking at all of our guidance based not only on where we are right now in the pandemic, but also on the tools we now have. We want to give people a break from things like mask wearing when these metrics are better, and then have the ability to reach for them again should things worsen.
This as the U.S. sees a drop in COVID cases. There are about 147,000 new cases and 9,500 hospitalizations per day, both down significantly. But 2,200 Americans are dying each day, with daily death rates still high in 15 states, and 97% of all counties still reporting high transmission. Officials still stressing that being fully vaccinated will protect Americans from more severe cases.
Boosters clearly, from the data we've seen from many countries, have played a really strong role in reducing your risk of transmission, reducing your risk of hospitalization, and reducing your risk of severe illness and death.
But the campaign to vaccinate all Americans is still a challenge. Recent federal data showing the average numbers of Americans getting their first vaccine doses and boosters each day has plummeted over the last 2 months. Just over half of those eligible for a booster reportedly have yet to get it.
What we've seen throughout the pandemic is that the risk around a particular variant or a surge actually drives vaccination rates. While we may have made some good progress on boosters at the beginning of Omicron, now that we're on the other side of the surge, the urgency around boosters is not there.
And a new setback in the fight to get all Americans the shot. The FDA postponing their review of Pfizer's vaccine for children younger than 5 years old.
There were no new safety issues coming out of the data set. There was additional data that was submitted to the FDA late last week on Thursday and Friday that changed the FDA's perception of the absolute efficacy of the vaccine.
The delay prolonging the stress felt by parents of young children still not eligible for a shot to keep them safe.
When it was available, we got right on it, so we wanted it for the kids too to be able to kind of be out in the world some more. So, yeah, it's unfortunate, I'd say.
I've been a parent since the pandemic started. My daughter was born right at the beginning of it, so it's just been anxiety the whole time. So I'm just excited for the vaccine to be here.
As guidance changes at the federal and state levels and the push to vaccinate everyone continues, some experts warn that COVID-19 may not be a disease that gets eradicated, but rather one that we learn to live with.
The hope is that, in the future, COVID will become part of the respiratory mix, and we'll have the tools between vaccines, therapeutics, and testing to manage those new variants and do so in a way that really limits the impact on our health systems.
Even as the nation prepares for a world where COVID may be here to stay, there are still reminders of the devastation that COVID can cause. Healthcare workers like those at Cheshire Medical Center in Keene, New Hampshire, are still seeing this in their hospitals.
You can see it in the patient's eyes. You know that they're scared and they're looking at you for support. And I really try hard not to show them my concern because I just don't want to add to their fear.
In California, 29-year-old Brittany Ramina, hospitalized since January, contracting the virus after spending New Year's in Las Vegas with her fiancé, Andrew.
Since the 22nd, she's been intubated. She's on life support, and it's just day by day.
Brittany, who was unvaccinated and suffers from asthma, has since been diagnosed with pulmonary fibrosis and now needs a double lung transplant.
She will not live if she doesn't get the lungs. She's only 29 years old.
As they wait for a transplant, Andrew insisting people need to take COVID seriously.
For some people to take things seriously, it has to hit you close to home, and it's hit us pretty close to home right now. It did hit my home.
Still such desperate times for some. Stephanie Ramos joins us now. Stephanie, what is a key barometer for changing mask guidance?
Well, right now it really varies from state to state. Health experts want mask mandates lifted based on data around hospitalizations. But right now, there are at least 10 states with low ICU beds, states like Texas and Georgia. And these health experts, they say they worry that in an effort to get back to normal life, these mask mandates will be lifted instead of relying on that hospital data. Lindsay.
Stephanie Ramos, our thanks to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.